I've been doing this for 20 years now, and what I find out, it's really kind of upset me with this situation. For people want to looking for easy way out. They, like I said, they don't want to know nothing about themselves, and they also wants the easy way out. Like drop the weight, like now in California, so what's it called, liposuction, like lipo. They remove that fat with those needles. It creates so much scar tissue, creates so much edema in your body. It's just unbelievable how bad it is for your body. But if you take I don't know, 90 days good nutrition, do a little bit exercise, you can drop all the weight. But you don't believe in yourself, and easy way out. Also, what you try to do, it's a medication. If you feel pain, experience pain, that you think the medication is going to help you. I believe the medication, what's to do medication to you, it's just to cut the symptoms. So you just drug yourself. You don't feel the pain. You drug up here from the pain area. So you cut that wire. You don't want to feel that pain, and that's not good because you need to correct it. Is something painful in your body? You need to correct it. You need to do job done, work done to understand why it's pain there, why it's present, and how you can help yourself to eliminate that pain. So, assessment program, great stuff, great material, 35 pages, and also great for the personal trainers, massage therapists, and everyone who wants to learn something. All right. So today I'm going to answer a couple questions for this knee. David tried to ask me about the knee, right? So what's the question?
The question is that people who have problems with their knee and maybe hip have and resist anything you looking at their foot or ankle, and they don't know the relationship between knee pain and the foot.
Yeah, so most cases, if it wasn't direct damage to the knee, let's say I'm playing soccer and someone just kicked me in that knee, or I was running and I don't know, falling down and I like dislocate my knee or do some bad damage. Most of the time people like, no, I don't do anything, I was just running and pain comes up. The most cases, yeah, it's above or below. So below it's ankle mobility, and below it's hip mobility, because our knee have to be stable joint, a little bit mobile, but most of the time it's a stability of the knee. So, and if just think about it, if your ankle is not mobile and you go run or lift some weights, it's going to be super impact to your knee. So a lot of people think about it. If I'm overweight and I walk like this, like a penguin, like this leg, it's put too much pressure on my lateral meniscus, and it's going to be damaged that. So a lot of people come when my knee is hurt, and I look at the postural position of the leg, and it's telling me right away what's happening with those people, and I see those runners every day in the park. Oh my God, it's just, I'm terrifying when I look at these people. I know they're going to be my customers sooner or later. They may be like good for another 2-3 weeks, and after, definitely going to be my customer. Big suggestion for people: if you try to lose weight, if you already overweight and you get some weight, don't run, please. Just don't run. You can walk, you can swim. Don't push too much pressure on those knee and on those ankles. Just think about it. If you like extra 30-40 pounds, like I don't know what's the 40 pounds, like a washer in your apartment. Just washer. Just think about it. You put the washer. Usually it's for the woman, it's on the front, and for the guy it's in the back, or it's like in the belly. Now think about your central of your body, like you completely unbalanced. If I'm gonna run with washer like this, what's gonna happen to me? My lower back is gonna hurt. I put too much pressure on my knee, lower back, everything, right? So that's why I'm highly suggest for you guys, if you are looking for a weight drop, do some static exercise on the floor put some gravity on your spine. And the best one is a resistance bands and static exercise like holding, yoga, planks. That's going to be really good for you. Uh, that's about ankle. Yeah, just if you're a massage therapist, check the mobility of the ankle, check all those plantar flexion, dorsiflexion, external, internal rotation, eversion, inversion of the ankle, and see if this is work. And if not, you have to correct that. All right. But like I said, if it's not our scope of practice, I always send people do MRI and bring his MRI back. Okay.
Also, some people don't know, like when when they show me their computer setup, they are.
Okay. So computer setup.
Oh, you're right. Yeah, you're right. And the computer is set so that their head is not straight. It's either up, it's too low, or it's tilting. And what does that cause?
Yeah.
After that's the case.
Really good question. So the David asked the question if set up the computer like your workstation is right, and it's really important because I see a lot of people. We go to those big companies and I see how people sitting. Some of them sitting like this on the side, turn the head. They got so many screens, one up here, one up there. He's sitting, turn the head, and he come to me. My neck has been hurting, and I'm like, yeah, it's no doubt it's gonna be hurt. And I just go see his station, and it's like this. Yeah, the one screen is up here, and this is how people work. And guess what? He get up and walk like this. And it's completely jammed. We have those OA joints. Your brain's so smart. They build you who you are. If you are sitting at the computer like this, you become this. You become the seahorse and you walk like this. You see, I can tell people when people walk in, I can already tell them what he do. You know, if he's like this, he's probably, yeah, I don't know, do some work, some what's the called warehouse, and he moves some heavy stuff. He always lean one side to another, or he's sitting at the computer desk and his shoulder rotated forward. Yes, it's really important to organize your workstation, especially if you do computers. I see a lot of people do those gaming, live streaming, blogging, and yeah, you can see the posture is terrible. Why? Because the workspace wasn't organized and set up correctly. That's true. So pay attention to that. Make sure your posture is correct. I know if you sit more than 4 hours, you start losing that. From nice postural correction, you start slouch forward because your body, you can't remember this, and you're tired to sit all the time. So if you work 2 hours, it's good to stand up, do the stretches, do some wall angel, open those rib cage, breath work, and that's gonna help a lot. So yeah, and of course do manual therapy monthly, every month. If you spend at the computer more than 6 hours a day for 5 days, you have to do postural manual work. And it's not just massage, it's really correcting your spine, the position of your head. And if just think about it, if you jam this head, if you're sitting like this all the time, what's going to happen? We got so many arteries up here, the vein is coming up, it's going to your brain. It's going to jam that oxygen, that blood circulation in the brain. Stroke. Boom. Such easy, right? So many. Look at this percentage of the stroke people in United States. I mean, in all around the world, because all this sitting, slouch forward, phone number, telephones. This is all about. So yeah, pay attention to that. Several questions I asking a massage therapist online. I saw that. So if I go to the house, because how to explain people what's the difference between professional manual therapy, massage therapy, and those like spooky mookie, whatever, Swedish massages. I don't nothing against Swedish massages, and I see all those championship in Europe. It's really popular. People do all this aesthetical massage, touch people, put some gallon of oil on people. It's maybe looks good, but I don't think it's do anything. It's maybe a great stress relief, but for the manual therapy, yeah, you need to really know what you're doing, follow those precisions and create great treatment. So what to tell your customers? If your customer's in pain, if you comes up in the house, or your person come to your clinic and he said, I'm in pain, my shoulder in pain, and he never done, most people not going to professional manual therapists. They just go those cheap places when they walk on them, you know, like I don't know what they doing up there, but the there's two way to explain. You say I'm got a two-way of this solution. It's gonna be one, it's possible you have a, like, I don't know, some spasm in your muscle, a lot of tension in your muscle, stress, we can just massage it and it's gonna go away. So we're not gonna do any assessment. In another way, we have to do assessment of your body and specifically do investigation of your body and find out where is the issue is. And after approach, and it's a long-term relationship, it's probably take 4 or 5 sessions, and I'm never promised the result to my customers. I'm gonna say, yeah, we're gonna, that was me like 5 years ago. Yeah, we'll fix you, don't worry about it. I'll got it. It's now, and 5 sessions gone, the person like, how you feel? I'm 10% better, 15% better, but it's still there. And you're like, okay, so you sounds like you are, how are you gonna say, misadvertise yourself. So I always don't say any like result. You're definitely gonna feel better, you're definitely gonna feel good, but just don't promise result, because sometimes people do nothing to continue. Just think about it. He's spending 12 hours at work, do his job, and 1 hour a month for manual therapy. It's not gonna do anything. It's gonna do good for like a couple hours. I mean, 1 day, 3 days, but it's everything come back if person don't do any work. So the option is, yes, we're gonna do assessment. We're gonna work on you, and let's see where they go, everything, and how you're gonna feel after. And if we fix you, everything is gonna be great. We just continue see you monthly, just to maintain you. So this is the thing. Someone just calling us, but that's how it is. What else I would like to add here? Oh yeah, and people, massage therapists ask me, so if I do 60 minutes massage, there's 10 minutes assessment, what you guys doing, so it's mean I have to lose my time, it's extra time. No, it's a treatment. You already put this time inside that treatment. So if your session is 1 hour, 60 minutes, or 90 minutes, you do 10 minutes assessment, it's already included in the session. Even your conversation is included in the session. Doctors, chiropractor, they do the same. So don't put yourself, wow, I have to do assessment 10 minutes plus hour, I'm losing my time. The great promotion for you as a massage therapist, I will probably do, hey, 10 minutes free assessment. Just come over, free assessment, and people will come for free assessment. But if you're already busy, it's no way, I mean, it's no point for you to do that. Okay? So I hope it's going to answer your questions. So every time, tell your customers it's 2 options. What do you want? You just want to relax. I give you a nice, good, full body massage, release your tension in your muscle, get your body tonicity good, release your toxins, lactic acids, and this should be good. But if you're in pain, I don't know, in knee pain, if we don't do any investigation, I don't want to poke like in the air and just make sure it's going to be good, like, you know, through the shit in the wall, make sure it's stick. No, it's not. So that's the thing. All right. Any other questions, guys? We can stop video.
Sometimes people have, they'll have pain that radiates, and they don't know, they think it's only going to be coming from, like if it's down the arm, it's only from the arm, and there's nothing here that, or here, it's going to affect it. It's like if the pain is in the arm, then you have to treat only the arm.
Okay.
Instead of working on all the neck,
yeah,
brachial plexus and stuff.
Yeah, this is David asked me the question, chasing the pain. So a lot of therapists and people chasing the pain because they think that the the symptoms of the pain. That's what the cause the pain, and this is the wrong most of the time. In I would say in 80% of the cases, it's something else is out, because we look at the whole body. We don't look and treat particular part of the body. I mean, I'm starting my session. Yes, if a person poke me on this problem, I will start with that area. Just make sure the clients are like, oh, okay, he's going to be calm down, and okay, the guy doing something about it. If think about it, if he have a like David said, tingling in the arms, in the fingers, and I'm start working on his neck, because I know maybe the problem is in the neck, and it's not the problem is in the tingling. It's a nerve. It's a nerve problem, and it's probably in the cervical area. People not going to be happy. They always say, "Oh, no, my pain is here. It's tingling in my arm. It's tingling in my fingers. I don't feel my fingers," because people don't know nothing about anatomy, and I don't want to be rude to them. I don't want to say, "You motherfucker don't know anything." So I just gonna say, "Hey, I'm start work with this area. I start work with the like biceps, arms. I know I can do this 10 minutes, and after I jump to the neck, ask him to do all those rotations, and that's the key. So don't make your customer look stupid, like, because some of them know something. They come in and but some of them people don't know. They just like, hey, my triceps is bad today, and they're poking on the biceps muscles, and it's no point for you to explain about this is nerve connection. It's a radial nerve, medial nerve, brachial plexus nerve, and they all go down your arm, and you can see that he shrugged that shoulders, and it's possibility he jammed that brachial plexus nerve, and it's up here, or he's sitting at the desk like we've been talking about all the time like this, and he's jammed that nerve connection, and it's go all the way down the arms. So that's the thing. Oh, it's a carpal tunnel syndrome. The person's standing at the desk like this and typing at the computers, and it's jammed this nerve. So aggravate that nerve. So what we need to do, yes, we need to mobilize that, release that extensors of the muscles, flexors, extensors, and should work. Suggestion, don't make your client look stupid. Yeah, because most of them, they are. Sorry. I gotta cut this off, don't worry. Maybe. Yes, you are. Because you think it's an easy solution for you, just put that pill and it's gonna go away. It's never going to happen. It's illusion, it's a trap, it gets you to the more deeper problem. So stop believing in this bullshit. Yeah, cortisol shots. Oh, wow. It's just easy solution. Yeah, let's just get this injections. And in my cases, people come in and say, oh, I think I'm going to go through injections. Hey, man, this is the bands right here. Bands. Just do bands exercise. Start using your neck as rotation with the bands. And I ask him all the time, did you done work on the bands? No, I don't have time. No, I don't have time. You don't have time for yourself? This is your life. This is all about. This is all about you, to feel good, to move good without pain. Just think about it. If you constantly experience pain in your life, what's going to happen with your head? You're going to get mad. You're going to get mad. You can create. You can clearly think about it. And your easy solution, it's you don't want to do hard work on yourself. All you do just, okay, maybe Jay is going to help me. Yeah, I help you, you feel good, and after you don't do anything. The bands, the exercise, the physical therapy, this is the way. And the most people, they don't want to do this because they don't want to spend time on themselves, which is completely unexplainable for me. But that's okay. This is our new era, new people, new civilization. Yes, I don't want to spend time. I want to spend time watching those stupid videos on TikTok or something. Like, I'm a couple days ago, I was on the TikTok. I'm like, the guy have like 10 million followers, and it's completely ridiculous. Like, this is dumbest shit I ever seen in my life. What people do up there. It's not educational. It's nothing up there. But this is who we are now. So the cortisol shots, it might be a solution. You get 30% of chance to get this problem go away, but guess what? You never fix your problem. You still head like this. You still you still walk like you walk. What's going to happen next? You don't experience pain anymore, but it's going to be start compensation in your body, start put some more pressure on different joints, different part of your body, and you're gonna blow another part of your body, and it's gonna be disaster. Trust me, I know those people. They just never walk again. They just lay down in the bed and just crying about this, and every month they do those injections, and this is how it is. And they have money. They have million dollars, but they can do nothing about it, and no one can help them anymore because they keep ignoring that stuff. All right.
Sometimes people, if their elbow hurts or their knee hurts, they just do the same running, same everything. They just wrap it. They put a band thing around it.
Yeah, that's
That is good. Yeah.
so compress. There was before there was, you remember the two recovery was rice and meat, rest, ice, compression, and elevation. Yeah, so this was the way of the recovery body. Now it's a meat, it's a mobility meat treatment. E, it's acceleration, and A, I forgot the A, antibiotic, I believe. Yeah, so meat mobility, we want to get that joints movable. You know, if you got surgery, you did like a scar tissue, as much as possible, as fast as possible, you need to mobilize that area to make sure it's movable again. I see a lot of people go to the gym and they injure themselves, and all they do just don't do nothing. They just wait for 2 weeks and they go back to the gym. They lower a little bit weight down and start lifting weights again. It's not working. It wasn't working in the beginning. You did something wrong. You partially been wrong, and you continue to do, and you do damage again and again and again, and that's what happened to people. That's why you have to check your assessment. You have to assess yourself. You have to assess your capability to do. You know, it's so many tests up there. It's a capacity test, like, you know, how much you can carry without losing your grip, or how jump you are, your explosion, your hanging stuff. Everything. It's a test. It's a professional. If you do any sports, specifically if you want to do professional sports, you need to find those professionals, the functional movement system people, and they help you to understand your body, and this is the key. If you just hurt yourself and you put those compressors on the knee or elbow, and it's still going to be in pain, it's not going to do anything. So, yeah. It's kind of support you in the beginning, but if you continue, go to your work. One thing I just will learn about this. So it's those support belt for people like who work at the warehouses or drivers. Think about it. Yes, it's going to help you in the beginning, but now all this belt, it's degrade your abdominal muscle, your hip flexors, so they're not working. You're not breathing properly. If this is belt always press on my stomach, I'm stop breathing. I want to breathe 360. This was what we teach in our morning class. You want to breathe 360. You want to extend all those muscles forward and be active in this area. If your abdominal not active, your glutes is not active, your lower back is always going to be in pain. So this belt in the short term period of time is going to help you to, yes, but if you're wearing this all the time, not good. And I see a lot of those people. They take those belts off, and I say contract your muscle, or nothing is working. It's just no muscles up there. You need muscles. That's why the bands exercise is the best, and it's been proved. Yeah.
People wear these freaking knee braces.
Knee braces, cortisol shots, I don't know. They tape themselves everywhere, those kinetic tape. Yeah, if you strain your muscle, you can apply the bands, of course, supported, but constantly wearing that band, is that glue coming on in your skin? I don't know. It's a short solution, but you need to stop and find a solution to treat that problem. So that's the answer. And of course, guys, you please leave your comments below, because it's really important for us you continue to ask those questions. And if you are clients, we in Los Angeles, we're professional manual therapists. We have four people in our team now, in our group. That's why be hurry and book with them. So we have a couple specialists with specifically lymphatic drainage massage, stress related therapy, and of course to sport injuries and recovery. That's really important to do monthly. It's like brush your teeth every day, do massage monthly too. Once or twice a month. This is the great time. I see a lot of people like, oh, I do 10 days in a row massage therapy. I would say I would do like 72 hours break between my session because I want to see the benefits of the first one, second one, third one, and my body recover, because my body recover on the own too. That's the key. And the older we become, the less it's recovery. It's need a longer time to recover, you know. All right. Any other questions? What's your clients usually ask you guys?
How often do I need to get treatment for injury?
Oh, injury, it's
Shoulder, yeah.
yeah, it's like I said, it's 72 hours between sessions, and it could be depends on the injury. And let's say if the guy gets some benefits on after 3 sessions, I usually say him, hey, come back in 2 3 weeks and see how you feel. If you feel pain, just go online and book with me again till pain is going to be gone. And don't forget to do your homework. And I always pointing to the different specialists, like a physical therapist, osteopath, or chiropractor. It's not just me, because I know if we work as a team, and if I know someone, it's going to be more beneficial for you, because my goal is put you back on track as fast as possible. I don't want to see your ugly ass here every other day. I just want you to out and come back for me only once a month. Okay? That's the key. If you think I'm trying to make money on you and tell you you have to come back here 5 6 times, it's not going to happen. For me, it's make sure you feel great and you do your like everyday routine without pain and pain free. This is our mission here. I'm not a doctor who's going to tell you buy this, do this and that, and just suck the money out from you. I want you to be healthy and happy. Client asked me about should I eat before, or what should I do before the treatments. I highly recommend, if you are take a shower and do not eat a lot of food. If you're hungry, take a little snack and drink a little bit of water. This is the case, because I see a lot of people eat and they come to the clinic or even drink alcohol. Some of them, yes. I got this experience. We usually go house calls, and sometimes people never say they have a party, and we arrived with a professional medical therapist, and it's like a party. Like people drinking and get some pool, and we're just like, okay. We do something like light stuff, a little like pulling stretches, but nothing serious have to be done, especially if you're under the alcohol or some other substance. Yeah, so we definitely not gonna continue work with these people. So light snacks, water, and that should be work. Okay. Is Christina come here? All right. So great. Another questions?
What would you say to do? What can we do for headaches?
Oh, I have one now.
There we go. Yeah, headaches. It's so the David asked headache. Such a big topic for the headaches. It could be not related to physical body. It could be the mental problem. Dehydration, it's one of them. It's a bigger one. So dehydration, I always highly recommend drink water with the magnesium, potassium, and what's that? Sodium. Yeah, sodium. It's people keep saying no sodium, but you need the sodium in the water in your body to eliminate that headache stuff. And last, coffee, guys, because coffee is create headaches. Yes, I know. I yesterday I drink coffee. I feel bad all day. I'm not a coffee drinker, but yesterday, I don't know why, I just decided to drink that latte because, I still remember those nice taste, and that wasn't that pleasant for me later. My stomach was completely messed up. I don't want to talk about coffee. I don't want to interrupt all businesses. We already lose so many businesses in California, so if we push the coffee shops away, it's not going to be good. People still need work somewhere, right? So yeah, also we can do neck massage, we can do scalp massage, head massages can be eliminate and decrease the pain of level. If you have migraines, I highly recommend escape like a bright lights, like a loud sound, very strong smells. Especially, we have a couple therapists who always use cologne and perfume on them. Shh, 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 a lot. So clients call me and say, "Oh, after massage, I got that headache. I got the headache after massage." Because I know every time I come to the clinic, I can smell that therapist like a couple rooms away. Yeah, I know that therapist is here. So, yeah, he's probably laughing right now. I mean, gonna laugh on this video, but yes. So I'm never try to get hard smell on me. Always light. And people very sensitive, especially with allergic right now. It's yeah, and food. I know this from experience. People eat some like onion stuff, garlic, and they come back and they hold the therapist, the client head, and like, how do you feel right now? And it's like that smell is just probably like already killed the person, and it's just like the guy like that's it. And you can't heal that headache because you already create more headache for this person. So really be careful what you eating, what you put on yourself. If you got a customer who's really affected by smell, just don't put a lot. Just put some little bit deodorizer, and it's okay if you smell a little bit sweaty. Just after jobs, switch the t-shirt, put some new t-shirt, and you should be fine. So yes, headaches and migraines, it's a big topic. It could be everything, and just always ask the questions for the customers. Is that like family related, or it's neurological, or it's like stress related? Look, right now everyone in stress. You turn the news, it's like, I don't know. It's like I turned the news yesterday. That's it. I can't fall asleep because it's so crazy up there. Yeah, they create this specifically for you, so you be, I don't know, die faster, not live happy life. So that's the thing. Okay. Any other questions? So we cover a lot: hygiene, customer support, like we have all these questions. We have an assessment book. What kind of questions you should ask your client? It's like top 15 questions. If you need more particular questions, you ask. Like I said, if you're not sure what you're doing, people come in and they name it some medication they use or some pathology they have in the body. I always Okay, hold on a minute. I just need to find out, especially right now. Before, when I started my practice, there was that big book like this, and you have to go and find that in this pathology in the book and read about this. Can you even apply that massage to this person? So now you just, hey Google, or hey Alexa, what's this about? And they're gonna tell you what's this pathology about, and can you apply this pressure to this person, or can you work on him? And it's okay to say no, and because you don't want to be sued.
People say no pain, no gain. How much pain, or what do they mean? Is there a good pain, or what should they
Yeah.
be looking for?
I was one of those guys. I'm even my T-shirt was saying no pain, no gain. You always push yourself through the pain. You're like, oh, my chest is hurt, but I'm gonna push. I'm go squat. My lower back is pain, but I'm gonna go squat. I'm sorry, I was wrong. This is like this. The pain is mean non-functioning body, and every time you experience pain, you have to really pay attention to that. So pain, it's non-functioning. You're not supposed to experience pain. Fatigue, which is, yes, you do some abdominal work or squats, your glutes, you feel that fatigue, but no pain. And just don't remember, if you got this long fatigue, muscling fatigue, you're going to get injury. Your body's just going to give up. Because your brain is so smart, they're just going to shut it down. That's why people running and they feel, oh, my knees like stiff. I feel like stiffness. This is body start sending you messages. It's not, you're not used to it. The body don't know what you're doing up there. So that's why you have to practice slowly, like increase the distance or speed, whatever you do, whatever you're training for. If you feel pain, non-functioning, doctor, physical therapist, manual therapist, right away. And guess what? Pain is never go away. Pain is not going away. It's always going to be there. If you not treat it, it's really bad for you. Pain is your messenger. It's your check engine light. If something happened, you always have to go and scan it. Like your car check engine comes up, you go to the dealership right away. I have this story. I'll tell you later. You have to check what's going on. I got this. Okay, I'll just tell the story. I was in Wisconsin, and I got this Lincoln car, a big Lincoln car. So I go to the dealership and drop my car. I was sitting and just wait for my car back, and this old lady come in, and she's like, oh my God, my car is check engine lights. It's something going on with my car. And the guy, I just was hearing this, and the guy asked, hey, when this happened? Oh, just like 20 minutes ago. And I'm like, okay. And I left. And guess what? 3 days later, this lady, same lady, come to my office, and she's come in, and she's like, my neck is hurt. And I'm like, oh, okay, so it's pain. Yes, it's pain. And I asked her, so how long the pain was there? And she said 12 years. So for me, it's like your car was broke down 20 minutes and you just go right away to check it. And your neck been in pain for 12 years and you never go and talk to anyone about it. It's just like sad. Your car is more important than your life, than your physical body, which is connected to this earth, and you only exist because of your physical body. So that's kind of story. Yes, if you experience pain, stop, ignore it. Okay, now we're gonna do yeah.
Another question about chronic pain. Some people have these pains for years and years, and it's like comes and goes. And when it goes, they like, oh, I'm fine, and then it's come back, and they took a pill, then it's helping for a while, then it's come back, and it's over years and years.
Yeah.
And then they finally try, and they don't do anything to manage the pain and get rid of it. So it's become chronic, and then they try and with one session of massage of 1 hour to fix it.
Right.
Yeah, I know. Yeah, that's a sad story. But Jana asked me if chronic pain all the time, and people come in to you and just like, okay, fix me in one session. Yeah, it's been chronic pain years and years, and that's mean they don't take care of themselves. They just don't want to know who they are and what's going on with them. They just prefer to live in pain. And yes, the sad story, they come in and say, I got this guy, he's arrived in the office, he's like, I got lower back pain for 10 years. I give you one time shot, you're going to fix this. Prove you are the best. You see that finger? That's what I want to say to you. If you don't take care of yourself, I'm not going to take care of you either, because I am, like I said, for me, it's a goal. We break the goal and you have to follow, you have to do it. It's not like a one chance, one session and I'm going to fix you. I'm not a Jesus Christ. I wish I'd just touch you and you get the fuck out of here, but it's not. You have to take care of your body. You have to take care of yourself. And chronic pain, it's tell you already, you've been wait for so long and you create more problems. And guess what? How you going to finish all this stuff? You're going to be that old guy who's sitting in the couch who can't get up from this couch because you experience pain. Your life is going to be miserable. And good luck with that. Okay? But chronic pain, for the massage therapist, I highly recommend start slowly. Start slowly. Get the soft tissue manipulation, activate the muscles around, work around, see what's going on, do assessment. If you people come in with chronic pain and you don't do any assessment, you just go ahead right away, dig in there. If you create more problems, trust me, these people gonna try to sue you and get some money from you. I get this experience in the past, not personally me, but some therapists got this. I saw that because, like I said, if people come in on chronic pain, I always do assessment. If they don't want to be assessed, I'm gonna say, okay, I'm not gonna I'm just gonna do light treatments, like light Swedish massage, and this is what they get.
I have another question.
Yeah, another question.
So sometimes people ordering the relaxation massage because it's cheaper one. But when you get there, you realize they need way more attention and they have a problem. Sometimes it's chronic pain, sometimes it's not, but relaxation is not enough to get them feel better. And but they paid already for the cheapest one, but they need another one. And
Yes.
that's become some problem too.
That's this. Okay, Jana asked more professional questions for massage therapists and for specifically for us. Okay, so let's say you're a massage therapist and you have a menu. You have menu stress-related massage, sport therapy, or medical. And of course, medical is need to be more education, more advanced program than just relaxation massage. And of course, Swedish massage is probably is the cheapest one, and people pick the cheapest massage, but when you arrive to the houses or they come to your clinic and they want this more expensive one. I usually do the treatment for them, do the medical, like they ask me, but at the end of the session, I will always explain. So what we done, that was the medical therapy, and for the future, I would like you to book that medical massage. And if the second time they're gonna do this again, trust me, they're gonna book the Swedish massage. And next time, I'm just gonna show them what's the Swedish massage, and they're not gonna be like, oh, but the last time you did differently. I'm already explaining to you. If the people don't wanna hear you, well, this may be not your customer. I'm like gently refuse to work on this person because there's so many people up there who needs my help. I can do only 80 massages a month. This is my limit, and I do have those 80 people, so I can't take new customers. I mean, now sometimes we do. Yeah. Just explain nice. I will show you what's the medical massage, and if they still book the Swedish cheapest massage, next time I'm giving Swedish massage, and it's not gonna do a lot for them. If they in stress, yeah, it's a good choice. Sometimes people book me medical massage and they come and they just want to relax, and I say, oh, you booked a medical massage, so what you would like to just a medical massage or Swedish relaxation? And they say, no, I just want a relaxation. I don't want any movements. I don't want to do any motions, any side position, standing position. I just want to lay down and relax. And I'm like, oh, wow, okay, you have $30 difference, so I can apply CBD on you or just put the credit for the next time or even reimburse this money. Most time people say, yeah, use the CBD lotion or whatever and just cover everything. Yeah, it's happened before. Like let's say it's honesty, and that's what the key is. Okay. Yeah, just tell them how you feel, but give them this first time session, for free. Just show them how different you are, because you are knowledgeable massage therapist. You're not that tutti frutti Chinese spas. I'm nothing against Chinese people, but all those area around us, I don't know what they're doing up there. Is that good? I'm a racist now or what? No, I mean because if I say Chinese, those Korean Chinese spa with those red lights on it, they're probably doing this too. I just I am not into it. Professional therapy is professional therapy, and there's a lot of professional people in the spooky places like that. So yeah. All right, now we're going to do our treatment, and we start from beginning. So if you are just started massage therapy, you're not even in the school, so we have who wants to be on the table? Okay, Yana want to be on the table. Let me turn this off.